What if two injections looked almost identical, worked in a similar way, and yet gave very different weight loss results? Ozempic, Wegovy. You've heard both names everywhere. Some people swear by one. Others say the second is better. And that's where the confusion begins. Because on the surface, they look the same. Same type of injection. Same weekly use. Same promises. But here's the truth most people miss. They look the same, but they are not. And by the end of this video, you'll know exactly which one makes more sense for weight loss and why. Suddenly, weight loss injections are everywhere. Social media is full of dramatic before and after stories. Celebrities are rumored to be using them. Friends of friends are dropping weight fast. And the names Ozempic and Wegovy keep popping up again and again. This explosion didn't happen by accident. These drugs showed real results, fast. But here's the important part many people forget. These are not beauty shots. They are not shortcuts. They are powerful medical drugs, originally designed for serious health conditions. And using them without understanding the difference can lead to disappointment or worse. Ozempic was never created as a weight loss drug. Its real job was to help people with type 2 diabetes control their blood sugar. In simple terms, Ozempic works by copying a natural hormone in your body that controls insulin and appetite. It slows down how fast food leaves your stomach. It tells your brain you're full, and it reduces sudden spikes in blood sugar after meals. That's why doctors prescribed it to diabetics first. But something unexpected happened. Patients started losing weight. Not a little. Sometimes a lot. They felt full faster. They ate less without forcing themselves. The weight loss wasn't the goal. It was a side effect. And that's the key detail many people miss. Ozempic helps weight loss indirectly. It's treating blood sugar first. The appetite reduction is real, but it was never designed to push weight loss to the maximum. Wegovy was designed with one clear mission: weight loss. Unlike Ozempic, this drug was built, tested, and approved specifically for people struggling with obesity. Wegovy uses the same core compound as Ozempic, but the intention is completely different. Instead of focusing on blood sugar control, Wegovy targets appetite, hunger signals, and long-term weight reduction. This wasn't an accident or a lucky side effect. Clinical trials for Wegovy were centered on body weight, waist size, and obesity-related health risks. That's why it received official approval for chronic weight management. In simple words, Wegovy is Ozempic's stronger cousin trained for a different job. It's not about feeling slightly less hungry. It's about sustained appetite control over months. That's what separates a diabetes drug from a true weight loss medication. Here's where almost everyone gets confused. Ozempic and Wegovy contain the same active ingredient. They are both injected once a week. They both slow digestion. And they both reduce hunger. On paper, they sound identical, so people assume they are interchangeable. They are not. This similarity is exactly why misinformation spreads so fast online. Someone loses weight on Ozempic and says it's the same as Wegovy. Another person takes Wegovy and calls it Ozempic. Even pharmacies sometimes blur the difference. But sharing an ingredient does not mean sharing a purpose. Water and medicine both contain hydrogen, but they don't do the same thing. The misunderstanding happens when people focus on what's shared and ignore how it's used. And that mistake can lead to unrealistic expectations. The real difference comes down to dosage. Ozempic is prescribed at lower doses because its main goal is blood sugar control. Wegovy is prescribed at much higher doses because its goal is weight loss. That one change alters everything. A higher dose means stronger appetite suppression, stronger signals of fullness, and usually more weight loss over time. But it also means a higher chance of side effects. This is not about which drug is stronger in general. It's about medical intention. Ozempic gently nudges appetite while stabilizing glucose. Same ingredient. Different dose. Different mission. That's the detail that changes the outcome. When researchers compare results, a clear pattern appears. People using Ozempic tend to lose weight steadily but modestly. People using Wegovy usually lose more weight over a longer period. This isn't hype. It's a trend seen across multiple studies. But here's the part that rarely gets mentioned. Results vary wildly from person to person. Some people respond fast. Others barely respond at all. Weight loss depends on consistency, lifestyle, dose, and medical supervision. These drugs don't work overnight. And they don't work alone. Studies show better outcomes when injections are combined with nutrition changes and follow-up care. Anyone promising effortless weight loss is overselling. The science shows progress, not miracles. These drugs are powerful. And powerful drugs come with side effects. The most common ones are nausea, vomiting, diarrhea, constipation, and fatigue. For some people, these symptoms are mild. For others, they can be intense. And here's the critical detail. Higher doses usually mean stronger side effects. That's why Wegovy users often report more discomfort, especially in the early weeks. Most side effects happen because digestion slows down too much, too fast. People with stomach issues, gallbladder problems, or certain endocrine conditions need extra caution. These injections are not harmless supplements. They change how your gut and brain communicate. Ignoring that reality is a mistake. There is no universal winner. That's the honest truth. If the main goal is blood sugar control with some weight loss, Ozempic often makes more sense. If the main goal is significant weight reduction in someone without diabetes, Wegovy is usually the better option. The decision depends on health history, body weight, risk factors, and tolerance. This is not a popularity contest. It's a medical decision. Choosing the wrong drug for the wrong reason can lead to frustration or harm. That's why doctor guidance matters more than online opinions. Better is not about trends. It's about fit. Cost changes the conversation quickly. Wegovy is often more expensive and harder to find. Insurance coverage varies widely and is frequently denied for weight loss alone. Ozempic may be easier to access because of its diabetes indication. But shortages affect both. Availability can change month to month, and paying out of pocket can be unrealistic for many people. Effectiveness means nothing if the drug isn't accessible. Long-term use also matters. Stopping suddenly can lead to weight regain. That's the reality most ads ignore. Sustainability is just as important as results. Ozempic is a diabetes drug that can lead to weight loss as a side benefit. Wegovy is a weight loss drug built to do exactly that. Same foundation. Different goals. Neither is a magic solution. Both require medical oversight, patience, and lifestyle support. The safest choice is the one matched to your health, not the one trending online. Before choosing any weight loss injection, remember this. The smartest decision is an informed one. What works for someone else may not be right for you. These drugs can help, but only when used correctly and under medical guidance. If this video helped you understand the real difference between Ozempic and Wegovy, take a second to like it. Subscribe for clear, honest health content without hype. And comment below which topic should we break down next. In the next video, we'll reveal what happens after you stop these injections and why many people aren't prepared for it.